Hello, I'm Mathew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. Louisiana is one of many states seeing spikes in COVID-19 cases. In fact, the governor there recently announced some new statewide mandates for wearing masks in public. There's a little bit of a slowdown in reopening the economy as well. And I'm joined today by Warner Thomas. He's CEO and President of Ochsner Health, the state's largest not-for-profit health system. We're going to talk a little bit about the challenge providers there and are facing as there's such a surge in the state. Warner, thanks so much for being with us. We know it's a busy time for you.
Hey, Matt, thanks for the opportunity. Great to be with you.
Thanks. So as I said at the outset, Louisiana is one of those states seeing spikes in cases. Interestingly, I think you're seeing a lot in sort of a younger population in your hospitals. Is that right?
That's correct. We're definitely seeing a difference in the number of cases of folks who are positive compared to when we had our first spike at the end of March and early April. Much older demographic of folks that were coming into our hospitals, much older demographic of people that were actually testing positive. Today we're seeing a much younger demographic, very high percentage that are under 40, much higher percentage actually 29 and under. So that is definitely a very different situation from what we saw with our last peak, which was right around April 1st was our peak as we went through the first surge here in Louisiana.
And so that younger population, that changed the dynamics of what you're seeing in terms of utilization, either in the ICU or elsewhere, because they are younger and presumably a little bit healthier?
We definitely are seeing a change in the utilization. I think a couple of things. One, we're seeing a lower admission rate. Two, we're seeing a lower utilization of the ICU. So a much greater percentage of folks, in med surg versus going to the ICU. A lot of folks that are not being hospitalized. So, a lot of folks that are essentially testing positive, but being able to be cared for at home. So we have not seen the escalation of inpatient cases that we saw, back in late March, early April. We have seen really probably a doubling in our hospital census over the last probably 2 weeks. We really were on a census across our system and our partners about 100 going 2 weeks ago. Today we're about 220, so we have seen a doubling. But that compares to really in late March, early April, we had a census at nearly 900. So certainly a lot different than the last surge, but we have seen a pretty large escalation, and we all have to take this very seriously and be very careful.
And talk a little bit more about what this is doing just for staff. You had the earlier surge, and now you're having this surge. How's your staff feeling? How are they dealing with a new spike?
Well, I think it's certainly something that's challenging just from a mental perspective to go through this. First spike was obviously very challenging, and folks knew we had come through the spike, and now to see this escalating again, I think it's very difficult. From our personnel, our management, our physicians, our nurses, to go through this again, and I think it's something that we tried to really explain as we were in March and April that look, we're going to be taking care of COVID-19 patients for months and months and months. This isn't something that's going to be a spike in March and April and then dissipate to really nothing. That we have to be prepared as a health system to have an ongoing census of COVID patients. Really probably into late 2021. I mean, who knows when we're going to have a vaccine, but we've got to be prepared for that mentally. We got to make sure we staff appropriately for that. We got to make sure we have the right PPE, which we're in good shape there. But it certainly is a challenge for staff because I think everyone wants this behind us. I think everybody in the country and in the world wants this behind us. But the reality is that COVID-19 is going to be with us for quite some time.
Right. Let's talk a little bit about Louisiana and the governor recently announced some requirements for wearing masks out in public.
Yes.
We've seen that conversation become a little politicized across the nation, unfortunately.
Yes.
What role do you think leaders such as yourself and clinicians play in trying to talk about mask wearing and science and social distancing?
Sure. Well, first of all, I would say that the governor of Louisiana, Bel Edwards, has done a great job handling the situation here in Louisiana. I actually spoke to him early last week, and we talked about the issue around masking. And I told him from our perspective at Ochsner, we recommended going to masking overall throughout the entire state. And he ultimately decided to make that decision, over the weekend. Coming back to COVID-19 is not a Republican or a Democrat issue. I mean, it does not care what political party you're in. If you get it, you're going to be sick. So I think this comes back to protection. This comes back to doing the right thing. And it comes back to, once again, when you wear a mask, you're protecting others around you, not necessarily yourself. And so we've adopted, pretty stringent protocols at Ochsner going back to when we started in this process. But we started our own Mask Up campaign. This Mask On campaign is important. We have our physicians out there, our nurses. We're spending significant resources marketing this. We're working with the Saints and the Pelicans, professional football and basketball organizations to help promote this on a local and regional basis. And really, trying to take the approach that this is a public health issue. The health systems have to step up and have a point of view on this. We need to be vocal about it. We need to be communicating it to our employees and in every venue that we get an opportunity to do so. So, and it's not just masking. I mean, that's one, but it's social distancing. It's washing our hands. It's using hand sanitizer. It's, being mindful about, not being in large groups. It's amazing to me. You see some of these functions or parties out there that, folks are in large groups. And I think in today's environment, that just does not make a lot of sense. So we don't view this as a political issue. We view this as a public health and a safety issue. And I think that's how everybody needs to look at it.
Well, and certainly New Orleans, known for people being in large gatherings, either there in the district or conventions that obviously have been postponed. So can you talk a little bit about the ripple effect that the economic slowdown may have on the health system?
Yeah, so I think, this is a situation where we view that COVID-19 and the economic impact, this isn't 1 quarter, 2 quarter, 3 quarters. This is a couple of year process to get through this from an economic potential. And, I think we've done a good job making sure we keep patients safe and having them feel like they are safe when they come to our institution. So we've seen our services continue to ramp back up and our clinics are getting, back close to what our pre-COVID levels were. But at the same time, we do know that the economic impact on a state like Louisiana and on a city like New Orleans is significant, where we have lots of tourism, lots of meetings that come to this area. It's a very social city. So yeah, this is a very large economic impact to our region, to our city, and certainly an economic impact to the economy, which ultimately does impact healthcare as well. I do think we've worked well through this, adjusting cost structure, taking the appropriate steps in that direction. We have not laid off or furloughed people, so we've been fortunate to not have to do that. But at the same time, we've got to be very mindful to watch this going forward. I do think the federal government's response to this has been, from a funding perspective to hospitals and health systems, has been very helpful. I do think the challenge is going to be what happens as we get further into 2020 and into 2021, because I think this is going to have a ripple effect for several quarters going forward, not just over the next 1 to 2 quarters.
Well, one of the conversations that's happening now, obviously, with the new spike is that question of delaying or postponing the so-called elective procedures.
Right.
What are your thoughts in Louisiana and for your health system on how you're going to manage that process?
I think at this point we're in good shape. From a volume perspective, from a capacity perspective, we're in very good shape. So I don't see this having any impact on our elective procedures at this point. Now, certainly, patients have to make their own decisions about whether that's something they want to do, and we're working with them to have them understand. We have a safe, a back to work safe campaign for companies that we're helping local companies around the region make sure they've got an environment that's safe for folks to go back to work. We've got a safe and clean, campaign that we're showing our patients what we're doing, showing our employees what we're doing to make sure it's a safe place for them to be. And I think we've received very, very positive responses from our patients. We ask every week, how are people feeling about, are they safe in the environment to come in for their clinic visits, for their ER visits, for procedures and in the hospitals. And we've actually seen our satisfaction levels increase as we've gone through this period of time, because I think we're taking extra care in helping make sure people stay safe, and we're doing an extra great job around communication. So I think that this is something that, once again, I think organizations address this differently, but I think our ability to communicate and to be very open and transparent with our employees, with our physicians, with our patients has really been part of our success in seeing more folks come back to get services.
Right. And we talked a little bit about your clinical staff and sort of how they're feeling. Talk a little bit about the remote work that your administrative team is doing and what the future may be. Are you going to bring people back to an office setting once we get out from under this, or do you think remote work is something that is here to stay?
So I think it's going to be both. I do think you're going to see more people come back into the office, although I think that's slower than I would have anticipated, frankly, if you had asked me this 3 months ago. We do have some people that are back into some of our corporate areas that are on site, but we have a very high percentage that are still remote, that are working, off site, from home. And I do think this is going to fundamentally change the work that can be done outside of an office at home, and folks' ability to essentially connect to work, and work at home or work in remote areas. So I think that's a situation that will continue. I think it's a situation that will grow. We were looking at a situation to potentially build additional corporate or administrative space prior to COVID-19. We've stopped that project. We are going to provide more opportunities for folks to work at home. And I think the other real strength in this is it allows you to recruit in a lot different way into a lot broader geographic region than you did previously. So I think this is going to be a real plus in many ways. I do think how you engage people, how you communicate with people, how you create teams is different in a virtual environment. And I think we're going to have a lot to learn there and to study as we go forward to make sure we create the right team environment, keep people connected, even though they're remote.
Right. I think one of the other things that's interesting dynamic is you recently signed that partnership with Singing River.
Yes.
It's interesting in this environment how that manifests itself. So talk a little bit about what you think that's going to bring to the region and how you bring those two organizations together in a socially distant manner.
Right. So we've been working on this relationship with Singing River for a couple of years, and certainly we're excited to create that strategic partnership with Singing River Health System. I mean, they're the leading health system in the Mississippi Gulf Coast. I mean, from a quality perspective, they've been the leader for years, and culturally very aligned with Ochsner and very aligned with the things that we're doing. So we see the opportunity to work to bolster certain service lines, in the Mississippi Gulf Coast together. We will coordinate our, clinical and administrative data. So we'll look for, ways that we can, collaborate on data sharing and ways that we can help them use our scale at Ochsner to help them in some of those administrative and corporate cost areas. We also, we've built a very large digital platform at Ochsner, and we'll be using and bringing that digital platform to Singing River to allow them to use that with their patients, to use it with employers. So there's a number of projects that we have going that will really continue to launch throughout 2020. But this is, partnerships are all about, culture and people. And we just see the right alignment with Singing River and with the leadership team there.
And the industry so well. So do you think that COVID will bring about more of these partnerships? Do you think it all will flatline? What do you think is going to happen in terms of that?
I do think you're going to see more partnerships. I think that one of the things that's key is that scale is important to continue to be able to be economically viable long term. If you look at the size of the insurance companies, if you look at the size of the tech companies, if you look at the size of the PBMs, the pharmaceutical companies, they're all significantly multiples larger than health systems. So, yeah, I think scale is going to be important to allow health systems to be successful in the future, especially as we see the transition of more people leaving commercial insurance, going to Medicare or Medicaid, especially as we have this economic downturn. That's going to create additional economic pressure on health systems, and I think that's going to be part of the catalyst to drive more partnerships or more, mergers in the future. But at the same time, I think it's really, critical to see, strong organizations like a Singing River is a very strong organization. Ochsner's strong organization. We just see that there's things we can do better together than apart. And I think you're going to see a lot more of that in the future.
Right. Well, lastly, Warner, you're in an area that obviously isn't immune to disasters. You lived through a lot of natural disasters. Is there any comparison, any lessons learned from the hurricanes that you've been through to what you've seen in COVID? And did that experience through Katrina and other hurricanes actually help you during COVID?
It absolutely did. Going through Katrina, which our organization did, and we've had several since then that we've gone through. A major flood in Baton Rouge we went through. I think it did help us. But I would come back to one thing. This is all about leadership. And I think what you learn when you go through COVID, when you go through a disaster, when you go through difficult or economic hard times, you learn a lot about your people. And, we invest significantly in our leadership and have for well over a decade. And because of that, actually 2 decades. And because of that, we did prevail well coming through Katrina. We have prevailed well in other storms, and we'll do the same going through COVID-19. It is about allowing people to be able to make decisions on their own, be able to focus on teams, enhance communication, move quicker, and at the end of the day, be agile and to adjust. It's not about changing direction. I mean, we find out new information every month now as we're going through this, and so you have to have very crisp, very connected short-term decision making as we learn more information, month to month and quarter to quarter. So that flexibility and having an organization and a leadership team that can do that, it's critical in a natural disaster. It's critical in a situation like COVID-19. And at the end of the day, this is about leadership. And I think health systems that have strong leadership, that have a strong direction, have a strong culture, have a strong strategy, will prevail going through this, and frankly, will probably come out of these situations stronger than when they went into them. But I think there will be others that will be challenged, and it'll be interesting to see how this evolves over the coming years.
Right. Well, Warner, we appreciate you taking some time. Again, I know it's extremely busy down there, so thank you. We'll love to check back in with you in a few weeks to see how things are going again.
Great. Matt, thanks for the opportunity and appreciate the great job that Modern Healthcare does too. So thank you.
Thanks so much. You too. Stay safe. Thanks. And I'm Mathew Weinstock with Modern Healthcare. Be sure to tune back in next Monday for the checkup. Thank you and stay safe.